guys, we'll be studying about the muscles and the nerves present in the lower limb. We'll study the bit introduction about these muscles. So as you can see, the the lower limb muscles are quite strong and they have a very coarse movement. And they are a bit stronger than the lower limb. The muscles of lower limb are stronger than the muscles of upper limb. It is a bit strong and it shows coarse movement. Muscles of the lower limb are a bit strong and it shows coarse movement than the upper limb. So we know that there is gluteal region. I had explained in the previous video. So this gluteal region mainly consists of 3 muscles in its region. So those 3 muscles are namely, first one is gluteus maximus muscle. Second one is the gluteus minimus muscle, and the third one is the gluteus medius muscle. Gluteus maximus muscle, gluteus minimus muscle, and the gluteus medius muscle. So these 3 are muscles which are present in the gluteal rotation, which helps in the rotation of the thigh laterally. Rotation of thigh laterally. It helps in the rotation of the thigh laterally. So these are the 3 muscles present in the gluteal region. Then mainly the lower limb is divided into, the thigh leg is divided into 3 compartments. It is having 3 compartments. It has the anterior compartment, it has the medial compartment, and finally it has the posterior compartment. It has the posterior compartment. So this anterior compartment mainly consists of the quadriceps femoris muscle. It mainly consists of the quadriceps femoris muscle. Quadriceps femoris muscle. It consists of quadriceps femoris muscle. You'll be studying about all these 4 muscles. Quadriceps, quadri means 4. So there are 4 muscles present in this region. You'll be studying all these muscles detailedly in the upcoming videos. It consists of, I'll just say the names of these 4 muscles. It consists of rectus femoralis, vastus medialis, vastus intermedius, and finally the vastus lateralis. Vastus lateralis. So it consists of 4 muscles in the anterior compartment: lateral femoralis, vastus medialis, vastus intermedius, and vastus lateralis. Quadriceps, in the name itself you can understand. Quadri matlab 4 muscles, femoris matlab present in the femoral region. In the medial compartment, you have mainly, you can see there is the hip joint. It is usually mainly helping for the adductor of the hip joint. It helps for adduction of hip joint. It helps in the adduction of the hip joint. In the posterior compartment, you can see the hamstring muscles. We'll be studying about all these compartments and muscles in the upcoming videos. Hamstring muscles. There is presence of hamstring muscles. There is presence of hamstring muscles. So this thing was about the muscles of the lower limb. You have anterior compartment, medial compartment, posterior compartment. In the anterior compartment you have quadriceps femoralis, 4 muscles of it. Medial compartment is usually helping for the adduction of the hip joint. Posterior compartment consists of the hamstring muscles. So now we'll look at the nerves of the lower limb. So the nerves of the lower limb is mainly derived from the lumbar plexus as well as the sacral plexus. So the nerves of the lower limb is derived from, you have lumbar plexus, that is from L1 to L4, and sacral plexus, that is from L4 to S4. The lumbar plexus is present in the posterior abdominal wall, whereas the sacral plexus is present in the posterior pelvic wall. Present in posterior abdominal wall. Sacral plexus is present in posterior pelvic wall. So these are the nerves. Now we'll look at the nerves, general nerves present in the lower limb. It has the femoral nerve. So it has femoral nerve. It has obturator nerve. Obturator nerve. We'll study about all these nerves in the upcoming class. Obturator nerve mainly has 2 branches, 2 divisions, anterior division and posterior division. There is also the sciatic nerve, also the tibial nerve. There is presence of the tibial nerve. There is common peritoneal nerve, common peroneal nerve. There is also presence of common peroneal nerve, and this common peroneal nerve is of 2 types, that is superficial peroneal nerve and deep peroneal nerve. So these were the nerve supply of the lower limb, general nerve supply of the lower limb. It is derived from the lumbar plexus L1 to L4, present in the posterior abdominal wall, and also there is presence of sacral plexus from the L4 to S4. In the posterior pelvic wall, there is presence of femoral nerve, obturator nerve, sciatic nerve, tibial nerve, and the common peroneal nerve. The common peroneal nerve is divided into superficial peroneal nerve as well as the deep peroneal nerve. So hope you like this video. I'll show these nerves with the help of a diagram. As you can see in the diagram, you have obturator nerve, femoral nerve, sciatic nerve, the sciatic nerve, common peroneal nerve, the tibial nerve, common peroneal nerve. See, you can see here it is getting divided into. You can see the common peroneal nerve dividing clearly the superficial branch as well as the deep branch. You can also see the lateral plantar nerve as well as the medial plantar nerve. So this is the nerve supply of the lower limb, generalized nerve supply of the lower limb. Hope you like this video. So in the next video, in the last video of the introduction of the lower limb, we'll be studying about the arterial supply, the venous supply as well as the lymphatics about the lower limb. Please do like, share and subscribe. Thank you.